Do you remember any teaching, anything that they said which you remember for about surgery or about life?
Surgery is not about speed. Patient is undergoing surgery. Patient has given her body in your hands. You have to respect that. You are not operating on yourself. That complications have taught me many things.
Till now, sir, what has been your toughest surgical case, technically or emotionally?
Toughest case, one case what I can remember is a young girl from Uttar Pradesh who I visited us with 4 previous surgery with a coloscopy. So she had multiple open surgeries with not treating the primary cause. So she had a big bowel involvement, bladder involvement, multi-compartment endometriosis. She got married and immediately subsequently in 2 years she had 4 surgeries. So we did a surgery for her and colostomy was closed. She recovered from the surgical part. She went for IVF.
Did you ever imagine that you will be such a big name in the field of laparoscopy in our country? Like everybody knows you today.
So I am one of them who are known for laparoscopy, but yes, of so many years put into the specialty, getting trained, getting advanced trained, training people. It has changed the journey from learning towards mentoring also.
Hello everyone. Our today's guest is not just one of the senior most laparoscopic surgeons in the country, but also one of the true pioneers who witnessed and shaped the evolution of laparoscopy in gynecology in India. At a time when laparoscopic surgery was still in its very early stages in the country and there was hardly any acceptance by people, he chose to step into a field which demanded vision, courage, and skill. And over the last 25 years, he has performed more than 25,000 laparoscopic surgeries. And he's one of the most respected names today in the field of gynecological endoscopy. Known for handling some of the most difficult, complex and challenging surgeries with remarkable calmness and confidence, Dr. Vivek Salunke is especially admired for his extraordinary expertise in endometriosis surgeries. Whether it's endometriosis which has spread to the bowel, the bladder, he is very good at handling them. There are many surgeons who are skilled, but there are very few who are actually fearless. And Dr. Vivek Salunke is undoubtedly one of them. But what makes him more special is that despite such immense achievements, he is also very well known for his humility, simplicity, kindness, and his deep dedication towards his patients and teaching. And sir, we are especially grateful to you after such an exhaustive and demanding day at work. You have come after so many surgeries and you still took out time and energy to attend this conversation. We are indeed grateful and it's our privilege to have you, sir, at our podcast.
Thank you, Kanika, for inviting me and thinking for such a nice podcast involving me as a speaker. So I am very excited and basically looking forward to this podcast.
It's an honor to us, sir. So the first question that I would like to ask you is, before becoming one of the leading laparoscopic surgeons in the country, who was Dr. Vivek Salunke as a young doctor? How would you describe?
So you ask like my MBBS days and my early days when I became a doctor. During my training as a MBBS, one thing I was sure, I am taking a branch which involves surgery. I had a keen interest and passion for surgical branches. So surgery used to keep me very interesting and involved, and so I took this particular.
So when you started laparoscopy, at that time laparoscopy in India, especially gynec laparoscopy, was in its very early stages. So what attracted you? What made you decide, okay, that this is it? This is what I want to do in future?
Yeah, so they started like that when I passed out MD. We had experience for laparoscopy in our residency.
Okay,
my teacher, Dr. Asha Dalal and C.V. Hegde sir, we had in our residency we were exposed to laparoscopy, which is not there in many medical colleges. I consider myself as a fortunate.
Yeah, fortunate, yes.
So that the interest started there.
Okay.
So once we were exposed in the residency, it makes a lot of difference in your understanding about. So we were not understanding basics. We already are done with that. And when I started my practice didn't start completely as laparoscopy. First 2-3 years I was doing general gynecology. Then seeing some stalwarts like Dr. Sankpal, and they were doing a lot of freelancing work during that time.
Okay.
So
That inspired you.
I seeing the cases, seeing the equipment involved, seeing the vision, I was very much interested towards that. And that was a time, I could say it would be around 2002 or 3. That time I changed my practice flow towards laparoscopy.
Okay.
Yes.
And did you ever imagine that you will be such a big name in the field of laparoscopy in our country? Like everybody knows you today.
So I am one of them who are known for laparoscopy, but yes, of so many years put into the specialty, getting trained, getting advanced trained, training people. It has changed the journey from learning towards mentoring also.
And that's why I said he's known for his humility. And sir, do you remember your first laparoscopic surgery which you did independently? How did that make you feel? Because at that time, even today, very few people learn laparoscopy in residency. So how did you feel when you did your first laparoscopic surgery alone?
So I had my undergraduate and postgraduate training at Nair Hospital and TN Medical College, where the advantage which my college gave me, my teachers gave me, was there was no thinking that whether I can do it.
Okay.
So that confidence, I think,
You believed that
a good institution always gives you, that you can always, the first thing which starts, if you feel that you can do it, you can surely do it. That's what I tell my students. First important thing is you should never see whether it can be done by me. So first case, we got trained with Dr. PG Paul in Kochi for a brief period.
Okay.
And we started laparoscopy. Before doing my first case, we planned the case quite in detail, and believe me, it was such a smooth case. Like I've heard that people take hours to do their first case, 4 hours. We didn't take that much time. It was very smooth.
Okay.
And without any stress. So I think planning and training help.
Yes, and pre-operative assessment really
Yes.
really
More you prepare, less you likely to fail. Yes.
So just like sir already said that he always believed that he can do it. I just saw the same concept in the movie Michael, which is based on Michael Jackson. So Michael Jackson in his mind was already the greatest entertainer of all times. So it's about the mindset also. If you have the confidence already that you can do it, that's what gives you courage.
Yes, that is very important message for all the youngsters.
You have to believe that you can do it.
Yes, believe in yourself.
Yeah, and when you started doing laparoscopic surgeries many years back, even today it's a widespread thing. People are very much aware of laparoscopic surgeries, but maybe 20 years back the acceptance was not much. So did you face any resistance? Did you have to constantly prove it to the patients? Did you have to explain again and again that laparoscopy is better than open? It is minimally invasive. So what were the challenges at that time when you had to counsel for laparoscopy?
So I think it was few years back I would have faced such issues. When I started doing laparoscopy, changed my practice from a routine OBGYN practice to laparoscopy, it was nearly getting said that patients wanting new laparoscopy, because we were practicing in the suburbs of Mumbai. We didn't have to convince a lot for the patients.
Okay.
The patients were getting willing for laparoscopy. And moreover, as a practicing gynecologist, I used to go to many hospitals where gynecologists used to call me to help in their cases, in surgical cases. So they had a good confidence that this guy will do safe and good surgery. So when I started laparoscopy, I would say they were the first doctors who helped me to get cases. Their own patients, not all patients could be generated by me, but their own patients, we could do laparoscopy safely. And as numbers grow, then the message goes. So then it becomes
easier to convince.
Yes.
And so today we have all the modular operation theaters, modular OTs. We have all the latest equipments. How were the operating rooms? How were the equipments back then? Was there any difference? Do you see a drastic change now, or was it the same? And also, Was there any difference in the complications? Like sometimes there are some rare complications of post-operative infection. Has that decreased now, or is it low? Was it low then also, and is it low now also? Any significant difference that you see in the operation theaters and the complications?
Yeah. So the experiences we had, basically my own practice started as a freelancing gynecology laparoscopy practice. I would try to explain that by, like, not all patients come to me and I operate them. There are gynecologists who will get the patients. I go to their hospital with my equipment, do the surgery for them, so that you can imagine how many hospitals, I mean, hundreds of hospitals I must have operated in at various. If I can write a book on experiences of how things were managed. So everything depends on the mindset of the surgeon who is calling.
I've heard that you had a convoy of those cars. Somebody had some
yeah.
So there was staff, and in the convoy of those cars, you were there in between, and
so that was the experience.
You used to go to the hospitals for surgeries.
Yes, so
everything was your own.
Yes. So the operation theaters were very. Some of them were very primitive. The anesthesia machines have changed. The operation theater equipment have tables, lights, everything has changed. The sterility has changed. Plus, our practice is shifted from small hospital practice to a bigger hospital practice. So that is a lot of change in my practice. But now even the concept of hygiene, cleanliness, sterility and patient safety is now in even small hospitals. I can see the change.
Okay.
But it was not the same in 2003, 2004. Yes.
So what were the challenges that you faced during there must be so many, but any one or two that you remember because of the hospital equipments or any infrastructure that
So I remember I don't belong to an era where VATEC cameras were used, where the security cameras they were used for laparoscopy by my seniors. Hats off to them. But then during our time already we had standardized some standardization, a single chip cameras which are hardly anything if you compare nowadays cameras what we use. The equipments, basically what changes the equipments. Equipments related to surgery, equipment related to the patient safety and anesthesia.
Yes. And who were your biggest mentors? Like you already mentioned some of them. And do you remember any teaching, anything that they said which you remember for life? Anything that your teachers have told you about surgery or about life?
Surgery is basically a surgical discipline. What is important? Discipline, respecting your patient. You can't practice like a surgical tomboy. So what happens is we have seen speed is never a criteria where you judge surgery upon. So I would say there are many teachers, but to start with Asha Dalal Madam, C.V. Hegde sir, Sanjay Patel sir. What changed my microsurgery into was by Sanjay Patel sir. Then again, I would say my total surgery changed after I visited Punta Mega sir in Pune, where I learned retroperitoneal dissection. All complex surgeries became more safer. So that was the turning point. Then my endometriosis surgery, Professor Keckstein and Professor Horace Roman, I visited their centers. I think these are the main mentors which helped me in my practice. And not to forget my colleague Dr. Shinjini Pandey. She joined me around 13-14 years back. We formed a team. She is an equally competent surgeon like me, but that teamwork changed the surgical practice.
So you learned so many things from across the world.
Yes.
Till now, sir, what has been your toughest surgical case, technically or emotionally?
So there are many tough surgical cases which we have operated for hours together with multidisciplinary team, especially deep endometriosis, as you say, as you can understand the complexities.
So we are always sure when we send you whether bladder is involved or bowel is involved, we'll handle it. We're so confident.
Yes. So it is forming a multidisciplinary team. Toughest case, what I can remember is a young girl from Uttar Pradesh who I visited us with 4 previous surgery with the colostomy. So she had multiple open surgeries with not treating the primary cause. So she had a big bowel involvement, bladder involvement, multi-compartment endometriosis. She got married and immediately subsequently in 2 years she had 4 surgeries. So we did a surgery for her and colostomy was closed. She recovered from the surgical part. She went for IVF. I think you only have done her IVF when she conceived. And that was, I think, the happiness on the
Yes,
patient's mind.
it's immeasurable.
Yes. So that was, and many other cases that way, but few of them
Okay.
really stuck,
Yes.
move you from interest.
Yes. And so you have seen so many complicated cases. There are such unexpected bleeders.
Yeah.
How do you stay so calm during these unexpected
Yeah,
complications?
so basically that is one of the things is experience. Initially in your initial formative years, you may get very worried, but once you keep on get involved in the complex cases, so what I tell my juniors is, my colleagues, my trainees, one is sensing your complications, sensing that things are going wrong, calling things are going wrong, whether things are slipping out of your hand or you need more help, calling for help. Please.
Yes, you are known for being very calm in the operation theatre.
Yeah.
So, is there any surgery that changed you as a person, not as a surgeon? Is there any surgery which just moved you so much?
There have been some complications because of the high volume surgical practice. We have had some complications retrospectively when we think. Every complication we study in very detail where things have gone wrong. But yes, small things matter. So especially I see that surgery is not about speed.
Yes.
Patient is undergoing surgery. Patient has given her body in your hands. You have to respect that. You are not operating on yourself.
Yes.
So whatever risk
Someone
you take,
else's life.
whatever risk you take in your surgery is actually taken by your patient, not yourself. So that attitude, that complications have taught me many things, and we have kept one principle as a unit. If we have a complication, we leave our routine work aside until that patient is okay. We don't leave that patient. That is my understanding and advice to all our juniors. Many times I have seen surgeons avoiding the patients when the complication happens. That is the worst thing you can do. Patient is worried. Patient is already in the problem.
Yes.
That time, if you have such attitude, it's not good.
Yes. And that makes the patient trust you all the more. If there's a
Yeah.
complication and you don't leave the patient,
Yeah.
it builds more trust.
Yes. Then patient thinks, the patient also has understanding that doctor has helped me out through it.
Yes.
And I think what patient thinks, the patient has to get okay.
Yes.
Till the time you are there with the
Yes.
patient. I think that is important.
Yes.
Important point you
Yes.
pointed out. Yes.
And so, what is the biggest misconception about keyhole surgery that people have?
Keyhole surgery, many times there were olden days, they say big cuts, big surgeons, big cuts, and you can see better, you can feel. But then keyhole surgery is not a surgery which is less invasive. It is the same surgery, rather it is a more precise and in detail surgery. So it is a more major surgery with minimal damage. So it is not a very small surgery. It is same. The surgical impact on the patient is same, but the discomfort to the patient is less. Cuts.
Yes. You have seen endometriosis evolve from an underdiagnosed disease to a major, disease in women's when it comes to women's health. And so, why do you think that endometriosis was neglected for so long during all these years? Now, since last 10-15 years, endometriosis is so much highlighted. But before, it was not so prominent, or it was neglected, or it was not given at that importance that it's given today when it comes to women's health, when it comes to fertility. So what was the reason?
The reason, as I would say, is the awareness plus normalizing period pain. Mother tells the daughter period pain is normal, and you don't like the importance to the patient symptoms are not talking about periods. It's a taboo. All these social issues coming to
and also
to
I
the
feel
light.
that laparoscopy had not evolved so much. So now more laparoscopies are being done and it's being diagnosed.
Yes. More, I would say the endometriosis assessment has improved. Because we were not able to see endometriosis on scans, we were not able to map endometriosis on MRIs, the sonographies. Patients have had 7 to 8 sonographies, nothing showing endometriosis when they have a deep pelvic endometriosis involving the bowel. So these situations are always there. But understanding, awareness has increased. There are a lot of social groups which discuss endometriosis in open. I think that has helped about the patient awareness of general practitioners, awareness of doctors, and training of doctors. I think that all has helped. Nowadays there are conferences which are focused only on endometriosis. So I think it is disease as such, it must have increased because of the change in the pattern. Patients don't get married early, because then they delay their childbearing.
Yeah. Do you feel that the modern lifestyle
Yes.
is contributing to the rise of incidence?
Yes. That could be some of the factors which could increase the incidence of endometriosis.
And why is endometriosis more than just a pain disease? So it's much more than that.
So I would say that endometriosis is not a cancer, but it has some properties to invade and damage the nearby structures in pelvis, outside the pelvis also. In pelvis, if you see around the uterus, there are the bladder, the bowel, pelvic nerves, and the ureters. All these vital structures are at risk if you leave a deep endometriosis untreated. Because we have seen there are silent kidney losses. It is a silent disease. You can have a urinary compression, and patients has complaining back and lost function in the kidneys. All these things are possible if the disease is untreated.
So it's so important. It can even make somebody lose kidney. Now that's too much.
Yes.
Yeah. How important is fertility preservation in endometriosis patients with endometriosis today?
As you know, Kanika, there is negative impact at multiple levels in endometriosis. First thing is it affects the tubo-ovarian anatomy. It affects the ovaries itself by ovarian endometriosis, endometriomas, and adhesions. It makes the egg qualities suffer. There is deep dyspareunia, the painful intercourse and sex. So all these things can cause infertility. And as patients get diagnosed with endometriomas, egg reserve can get negatively impacted. So it is important that you should discuss fertility issues when you diagnose a patient with endometriosis, a young patient, regarding fertility plans. There has been one very popular misconception that when a gynecologist sees a patient, even senior doctors, at times they may say, you get married and have a pregnancy. It is such a wrong advice to give a patient, because you can't do that. Yes, you can advise them, discuss them with the fertility negative impact of endometriosis, and advise them freezing of their eggs and freezing of their embryos if they are married, and then they can have their pregnancy.
Now that we have the option of egg freezing, and I also have young girls who had big endometriotic cysts. They came to me for freezing the eggs, and then they got it removed, the endometriomas, because it was causing too much pain. But they were aware that we have to freeze the egg before going for surgery, because definitely surgery may have an adverse impact on the ovarian reserve.
Yes. So I would say the fertility, it's not a fertility practice and a surgical practice different. It has to sync.
Yes.
It has
to be a teamwork.
It has to think. It has to, whatever is most important is the benefit what patient is going to get.
Yes.
You can't ignore pain as a symptom when and just push patient for fertility. As I've seen some fertility centers do. No, patient in severe pain, 10 by 10 pain scores, but then they push the patients for fertility treatment. So this type of pattern, it has to be a sync between the surgical practice and fertility practice. I think so. Yes.
10 by 10 causing pain is an urgent call for surgery.
Yes.
So what excites you most about the future of gynecological endoscopy in India?
India is looked for as a competent surgical skill destination. We get a lot of international patients, Indians staying abroad from various centers where, like,
I'm sure you must be operating on patients from all over the world.
Yes, especially Indians staying in other countries. Many countries have a long waiting list. Even to get an MRI in a particular country may take months together. So what advantage we have here? We have a short waiting list or short duration. Like suppose patient with diagnosed endometriosis can plan, get a surgery done, go back within 2 weeks. It's possible in our country because
definitely. Healthcare system is very good.
Yes. So the MRI is easily possible, and we can plan the surgery early because of the not having a waiting list.
Yes. Now coming back to the most talked about thing about surgeries when it comes to gynec endoscopy, the robotic surgery. Do you think, sir, that robotic surgery will replace laparoscopy or will coexist with it? When does that have an upper hand, and when does laparoscopy have an upper hand?
Okay, so I have seen the transition coming from 2D cameras, then we can 3D. Like I have if someone asks me to do a surgery in a 2D camera today, I will not be very comfortable. So once you get used to, basically it's equipment.
Yes.
Surgical principle remains same. If surgeon doesn't know how to do the surgery, whether he use robotic, whether he use 3D laparoscopy or 2D laparoscopy, he is not going to give a good result. So understanding principle of surgery is same. Equipments, yes, one thing is very sure. 3D vision is the minimum requirement for endometriosis surgery according to my surgical practice experience. You should have a 3D vision. So either 3D laparoscopy or robotic is the equipment which we should use for endometriosis surgery because of the deep pelvic surgery understanding. Robotic surgery may not be that available. We have not many installations in all over India. And plus the cost factors, you can't offer to many patients.
Even the training.
But nowadays training is getting more eased out. Many surgical robotic companies are coming. At present, if you ask me as experience, 3D laparoscopy or robotic in my hands, the surgery will be same.
Okay. And so you handle such high volumes of surgeries at your place. How does it affect your family or personal life? Is your wife always complaining?
My wife Aditi, she is also a doctor. My daughter is just recently become a doctor now.
Okay.
So I don't come from a doctor family myself. My parents are.
But you are a doctor family now.
Yeah. So they don't have. They also are.
They are also busy.
But then they have been very supportive. Basically, yes, that has helped me in my practice.
Yes.
I'm very grateful for that.
That's great. That's great. Very lucky that you don't have a wife who's angry at you for
no,
working for such long hours. Because I'm sure you're working for long hours.
Long hours in practice. But then a good case, we have a good discussion at home that what happened to the patient.
Okay.
Yeah.
And so after thousands and thousands of surgeries, what has the operating room taught you about life? What has the operation theatre taught? That is the place where you spend most time of your life.
Yeah.
So what has that taught you about
So
life?
biggest teacher for us is our patients and the respect towards them, respecting their requirements, talking to them in detail, giving time to them. That is utmost important. So now it's maybe around 5-6 years. Myself and Dr. Shinjini, we had this Nalini Specialty Hospital where we do things our way. Our way means best possible care to the patient with good cost, where we have best equipments and patients feel most respected, cared for. They don't have that insecurity. I think it is important. What laparoscopy has taught me is discipline, respecting your patient requirements, and it's not about doing many surgeries or speed during surgeries. It is doing a surgery in a complete way because that surgery is the only surgery for the patient.
Yes, definitely. That is so thoughtful. Sir. That is so thoughtful. And how do you see yourself in future? Like, what do you want? Anything now that you think that you will do this or that in future?
So I was coming to that because my passion is deep endometriosis surgeries and the disease load in our country or all over the world. We don't have that many surgeons, competent surgeons who can perform safe surgeries for this because the surgeries are complex. So training more and more people is my aim. We have already trained many surgeons. We have open observership in our center. But my aim is to make this surgery safely available to maximum number of people, patients. So that
and so even I feel that what we see in metros, the incidence of endometriosis is we are seeing because of the good diagnostic modalities.
Yes.
But about the periphery, I think this is the tip of the iceberg. Endometriosis must be much more in villages where the MRIs or the ultrasound skill is not that good to catch endometrioma.
So big role of awareness, big role of offering surgery at affordable cost for all set of societies. I think that is my main goal in getting involved in all this.
Okay.
So we have Association of Endometriosis Foundation of India with Dr. Vivek Salunke in Hyderabad.
Okay.
So there's a lot of good work happening on this, awareness plus charitable surgeries.
Okay.
So more hands have to come. A particular surgeon like me, I have limitations of doing number of surgeries.
Yes. So training is the best gift that we can give to society.
And instead of saying that I am the only person who can do it, I let 10 more people train under me who can do more surgeries and train more people.
Yes, that is a very good thought. Thank you so much. I think we are done with all the questions. Thank you so much, sir. It's really an honor to have you and to hear from your experiences. We are indeed honored. Thank you so much. Thank you, everybody.
Thank you so much.
Thank you.